Hello, I'm Dr. Amy Sisson, Yolo County's health officer, here with an update on COVID-19 in Yolo County. I'm recording this video because I want you to hear directly from me at what is a critical moment in the response to COVID-19. On the surface, the COVID-19 situation in Yolo County looks good. The number of new cases each day is stable, very few people are hospitalized with COVID-19, and over 40% of residents have received at least one dose of vaccine. However, below the surface, there may be trouble brewing. That trouble is in the form of growing numbers of cases of more infectious variants. Yolo County identified its first case of the B.1.1.7 variant, also called the UK variant, in early February. Initially, numbers of B.1.1.7 cases remained low, but they've risen significantly in recent weeks. Since the middle of March, the proportion of new YOLO cases caused by the B.1.1.7 variant has increased each week from 7% to 13%, then 48%, and most recently, 67%. According to data from the UC Davis Genome Center, 2/3 of new cases in YOLO are now B.1.1.7 variants. This is concerning because the B.1.1.7 variant is 50% more infectious than the normal strain of coronavirus and also causes more severe disease and death. The B.1.1.7 variant is behind the current surge in Michigan, as well as recent surges in Europe. If total cases are flat, why am I worried about B.1.1.7? 2 words: exponential growth. Numbers may be small now, but as they double and double again, small numbers quickly become big numbers. Our cases may be flat because the increase in B.1.1.7 cases is being covered up by a decrease in cases caused by the normal or wild-type virus. A graphic will now appear on the screen. The top row shows 2 curves, one going down, which is the decrease in cases we see caused by the normal or wild-type virus, and one curve going up, which is the rise in B.1.1.7 cases. The bottom row shows where they cross in the middle, creating a relatively flat section with steady cases. But as the curve going down approaches 0 and the curve going up keeps going up, the total number increases and you no longer have a flat line. At that point, we would have a surge in cases. A surge that could look like Michigan, where hospitalizations from COVID are climbing and experts predict a surge worse than the fall surge. We may be able to prevent this possible surge if we double down on current protective measures, testing, and vaccination. All 3 of the available vaccines work well against the B.1.1.7 variant, so we can fight the growth in B.1.1.7 by getting more people vaccinated. Everyone 16 and older is now eligible to receive the COVID vaccine, and thousands of doses are available in the county each week. I strongly recommend that everyone 16 and older get vaccinated unless they have severe allergies to vaccine components. Vaccines are free, they work, and they are safe. Yolo County is shifting most of its vaccine appointments to the MyTurn platform. If you're interested in getting vaccinated, sign up now at myturn.ca.gov. The more people who are vaccinated, the harder it is for the B.1.1.7 variant to spread. Until you are vaccinated, it is important to get tested regularly, even if you aren't sick. 40% of people who are infected have no symptoms, so the only way to know that you aren't infected with COVID is to get tested. There are free public testing sites in Woodland, West Sacramento, and Winters, in addition to Healthy Davis Together in Davis, and numerous pharmacies in the area. They all provide results within 1 to 2 days. If you have COVID symptoms, you should get tested even if you've been vaccinated. Please, don't assume your runny nose and sneezing are due to allergies because they could be COVID. Please get tested. If your child is participating in in-person learning at public schools, I strongly encourage them to participate in free, regular on-site testing. This testing allows us to keep a close eye on cases in schools to make sure that students and staff aren't spreading COVID on campus. If people don't get tested, we won't know if they have and are spreading COVID. Testing and vaccination are going to become even more important as Yolo County moves forward with reopening. On April 15th, the state began allowing more indoor events like proms, wedding receptions, and concerts. Indoor events and activities pose a higher risk of COVID transmission than outdoor events and activities. Just because the state allows an activity does not guarantee that that activity is completely safe when it comes to COVID. This is especially true where more contagious COVID variants like B117 dominate, like they do in Yolo County. I strongly recommend that organizations, businesses, and individuals that host indoor events require all participants to show proof of vaccination or a recent negative COVID test, even when not required by the state. Even better would be to hold these events outdoors, where ventilation reduces the risk of coronavirus transmission. In general, whenever given a choice of outdoors or indoors, opt outside. Keep in mind that outdoors does not mean a tent that is fully enclosed. A truly outdoor space must have at least two sides open. We are very close to a time when we can get back to something resembling normal, but we aren't quite there yet. And if we aren't careful, we may find ourselves in the middle of another surge. So as we reopen, please get tested, get vaccinated, and opt outside.